So hi, my name's Emery. I am a student nurse. I'm going to be giving the medication Cloxacilin via minibag to Emma Wrightson today. So she has cellulitis. So I'm going to wash my hands. So we have Wrightson Emma, so Emma Wrightson. Her PIN number is 123456789. She's born on October 20th, 1990. She has no known allergies here. She's getting Cloxacilin 750 milligrams IV every 4 hours via minibag. So she hasn't received this yet. I've already compared the MAR with the physician's order. Everything has been transcribed correctly. There's no errors there, so I'm going to proceed with the MAR here. So I've already grabbed my Cloxacilin prior to this from the Pyxis, so I'm going to do my first check. So we have Cloxacilin, 750 milligrams. So there's 2,000 milligrams in here, which is 2 grams, so that's enough for me to pull out. It's given IV, so it says for IV infusion only. It's not expired, it's still okay. It is intact and everything's good, and it's given every 4 hours, so he hasn't received it yet. It's just been ordered, so I'm going to be giving it to him now. So I'm just going to check the PDM on how I'm going to prepare the medication here. So we have Cloxacilin. It's an antibiotic, so this is to get rid of his infection he has. It can be administered by a nurse or student nurse in any clinical area, so I can give it. The usual dose is 1 to 2 grams IVIM every 4 to 6 hours. I'm giving 750 grams, so that's within the range. The maximum single dose is 2 grams. My dose is 750, so that is well below it. It's supplied as a 500 milligram, 1 gram, and 2 gram vial. So I have a 2 gram, so 2,000 milligram vial here. So reconstitute 2 grams with 6.8 milliliters of sterile water for injection. So I've already grabbed my sterile water prior to this, which is going to give me a final volume of 8 mLs and a concentration of 250 milligrams per ml. So I need 750 milligrams over 250 milligrams per ml, which is going to give me a volume of 3 mLs after reconstitution. So for a 500 milligram to 1 gram dose, dilute the dose in 50 to 100 ml sodium chloride, 0.9% or D5W, administer over 30 to 60 minutes. So I've already chosen a 100 ml 0.9% sodium chloride bag, 100 mLs, just so that I can dilute the medication to reduce any adverse effects, since this is probably his first time getting it. And I'm going to administer over 60 minutes just so I can monitor for any complications and I have time to fix that. So for compatibility, it's compatible with sodium chloride 0.9%, which he does have as a primary, so the medication is compatible with that. And I've gone over the potential hazards: diarrhea, nausea, hypersensitivity, etc. So I'll wash my hands one more time. Grab an alcohol swab. I'm going to use a 10 ml syringe just because I'm pulling out 6.8. That's a good amount. So remove the metal part, and I'm going to swab the tops for 30 seconds, and I'm going to dry for 15. It's going to be shortened due to demo purposes here. So wing back my syringe.
And now I'm going to attach this to a port that's above the
Could not get it on there. So I'm going to be reconstituting 6.8 mLs. Right, and I'm going to inject 6.8 milliliters of air. A little bit of spray back, but that's okay. They're reused vials.
Okay, so I would connect it to a port above the pump, and I would swab the port for 30 seconds.
And just inject air in and out just to get my dose.
So I would then set my secondary, since I can't really attach that here.
And I'm going to recap my syringe and take out any bubbles that there are. So that's 6.8 milliliters of the sterile water there. I'm going to reconstitute it in my Cloxacilin. I've already swabbed the top of it, so it's clean.
And then I would ideally want to start, since I'm on port, I'm just going to manually push start.
And I'm going to take out any air that's in my vial.
I also would have backpacked as well.
Right. And recap my syringe. And I'm going to roll the medication in between my hands so that the medication is fully dispersed here. And And like I said, I'm going to be taking 3 mLs of the medication. So there's no sediment at the bottom. The medication is fully dispersed. I'm just going to swab the top one more time because I probably touched it while rolling it. So swab for 30, dry for 15. And I'm going to be taking out 3 mLs. So I'm going to inject 3 mLs of the air in there. And recap my syringe there. And take out any bubbles that there are. So that's 3 mLs of my Cloxacilin there. I'm going to do my second check. So this is for Emma-Wrightson. The medication is Cloxacilin. I have Cloxacilin in here. It's 750 milligrams, so there's 2,000 milligrams in here. After reconstitution, it's 8 mLs in there, so I've grabbed 3 mLs. It's given IV, so it's for IV infusion only. I'm going to be diluting this in a mini bag, and it's given every 4 hours, so he hasn't received it yet, so I'm going to be giving it to him now. Right? So I don't need those anymore. So I've already explained why I'm going to be choosing a 100 ml sodium chloride bag, reduce any adverse effects, and I can monitor for any complications. It's not expired, it's still okay, and there's no perforation, so I'm going to proceed to give it. I'm just going to swab the port for 30 seconds and let it dry for 15. And I'm going to instill the medication without puncturing the bag. There we go. Okay, this would go in the sharps container. I don't need it anymore. And I'm going to roll my mini bag around so that the medication is fully dispersed. And I've already made my med label for this as well. So I have Cloxacilin, and my dose is 750 milligrams, which is going to give me a volume of 3 mLs, and I'm diluting it in 0.9% sodium chloride, 100 mLs, so that's going to give me a total of 103 mLs per hour. I've already calculated my rate as well, that's 103 mLs per hour, and it's October 20th, 2020, time is to give it now, and I put my signature as well. So I have my MAR, I have my mini bag, I have my alcohol swab, my secondary tubing set, and a pen. So this would all be cleared up. So I'm going to enter the patient's room. I'm going to do my hand hygiene. I'm going to do my engine safety check. So I see his IV is running. The patient is not in distress and his bed is at the lowest position. So hi, I'm Anne-Marie. I'm going to be your student nurse today. I have your Cloxacilin that is due now. I'm just going to compare my MAR with your wristband to see that I have the right patient with me. So can you state your first and last name, Emma-Wrightson, and your date of birth? October 20th, 1990. Okay, perfect. I have that as well. And do you have any allergies? No? Okay, great. So I'm just going to do my third check just to see that I have everything with me. So we have Emma-Wrightson. I'm giving Cloxacilin, 750 milligrams, which is 3 mLs, which I've diluted in the 100 ml sodium chloride bag, giving me a total of 103 mLs. It's given IV, so it is an IV mini bag. He does have an IV running at the moment. It is compatible with this, and it's given every 4 hours, so the time is to give it now, since he hasn't received it yet. I'll wash my hands one more time. I'm going to check his IV that he has running. So he has sodium chloride running at the moment. His primary bag is labeled, and his primary tubing is labeled as well, so that's perfect. He has 25 mLs per hour running with 476 mLs left, just like in the physician's order. So I'm going to look at the tubing and look for any kinks or any bubbles. If there were any bubbles, I would flick them out, or I would grab a syringe and pull them out. All the clamps are open here. All right. And the clamp is open here, so I'm going to check the IV site. So there's no redness, there's no swelling, no warmth, no IV complications of phlebitis, etc. Is there any pain? No pain? Okay, perfect. So I'm going to educate the patient now. So I have your Cloxacilin. This is an antibiotic for your cellulitis. So this is just to get rid of the infection that you have. So some side effects can be nausea, vomiting, hypersensitivity. So we will monitor for that. Did you want to take the medication? Yes? Okay. So he doesn't refuse, so I can proceed to give him the medication. So I'm going to grab my tubing. So since it's given via minibag, I'm going to lower the primary. So lower that. Make sure my clamp is closed here so that I don't spill out any medication. And I'm going to, wrong side, obviously. So I'm going to spike my minibag with maintaining sterility here. So we've maintained sterility. Good. And I'm going to hang it higher than the primary bag. So my secondary bag is labeled. I would also label my secondary tubing as well with the date, time, and my initials. I'm going to choose the port above the pump just so that it regulates the medication properly. So I'm going to swab the port for 30 seconds, and I'm going to let it dry for 15. Right. And I'm going to connect the secondary to the primary. And I'm going to back prime my medication.
No pain. Okay, sounds good. And I've also noted that there's no redness.
So there's no bubbles in my tubing, and the drip chamber is at least 1/3 full, so that's perfect. I'm going to set my rate now. So we're going to go to the secondary. So my rate I chose is 103 mLs per hour. It's going to be a volume of 103, so I added the medication there. My call bell is going to be yes, because I want to come back and see that everything has flushed and everything. So I'm going to confirm my secondary. I'm going to press start. I'm going to make sure everything is open here, and I'm going to wait for 3 drops so that I know my medication is running. So we're probably going to wait a while, but all the clamps are open here, and his rate is set. So 1, it's 1, and the green, that's 2. And his green light, the green light is on as well, meaning that everything is running, and that's 3. So his IV is running. I've also programmed a 15 cc flush as well. So once the medication has infused, the 15 cc will flush the rest of the medication so that the full dose is given. I'm going to also document on my MAR the time that I gave the medication and my initials, and I'm also going to document that in the fluid balance sheet as well. So I'm going to give you the call bell here. If you have any concerns, complications, let me know. I'm going to be back in an hour once the medication has fully infused, just so that, so I'm going to come back in an hour once the medication infused, just to see that the primary has kicked back in and that the flush has flushed all the medication to give you the full dose. But I'll come back and check up on you, check your IV site, how you're doing. So the primary and secondary bags and tubing are labeled. The primary or the pump is running. The patient is not in pain, he's not in distress, he has his call bell. The bed is at the lowest position. Everything is cleaned up. I've documented in the MAR and the fluid balance sheet, so everything looks good. So I did my exit safety check.